High blood pressure is called the silent killer, and under new guidelines today from the American Heart Association, nearly half of Americans have it. That's up from a third. Dr. Jon LaPook has more now about the leading cause of heart disease.
At a health fair in New York City today, Adrienne Williams suddenly found herself with a new diagnosis of hypertension. Her blood pressure in the 130s.
Hypertension is considered a silent killer, and now it's something I need to kind of research. And I wouldn't have known that had I not stopped through today, so I'm so happy I did.
The new guidelines now say just a top number of 130 to 139 or a bottom number of 80 to 89 qualifies as high blood pressure. This used to be considered pre-hypertension. Previously, a top number of 140 or more or a bottom number of 90 or more was considered high blood pressure. The new guidelines add 31 million adults to the category of hypertension, now totaling more than 100 million. The American Heart Association and the American College of Cardiology are doing this to urge Americans to pay attention to hypertension before it causes problems like heart attack, stroke, and kidney disease. Dr. Paul Welton chaired the committee that put the guidelines together. He says these additional patients now classified as having hypertension should be able to manage their condition with diet and lifestyle changes alone.
Most of them just need to know they're at high risk, but they can manage that problem on their own.
The committee says the best ways to lower blood pressure without drugs include weight loss, exercise, and a low-sodium diet. Alcohol, anti-inflammatory drugs, and caffeine can make blood pressure harder to control. Anthony?
Dr. Jon LaPook, thanks, John.